Hi, my name is Windsor Shui, and today I will be performing a sterile dressing change. I learned in this week's video, I'm doing remediation, I learned in this week's video that we're supposed to take our name badges off in sterile situations. So I do have it, but I am going to remove it just because this is a sterile procedure. Alright, I'm going to go ahead and lower the camera so you can kind of see my playing field here. Alright, so to begin, I would perform hand hygiene. I would enter the patient's room and I would pull the curtain for privacy. Mr. Smith, can you please verify your name and date of birth for me, please? Perfect. Alright, so today is the day for your dressing change. So I'm going to go ahead and remove the old dressing and I'm going to apply, make a sterile field and apply a sterile new dressing. Is that alright with you? Perfect. So to begin, I would apply my non-sterile gloves. And I would take a look at the wound, and I would begin to remove the old dressing parallel to the wound. And this has been removed quite a few times, so it's kind of a mess. And I would place it in my sterile biohazard bag. I would then go ahead and remove my gloves, and I would perform hand hygiene again. Then I would go over and I would get my sterile dressing kit, and I would open it. This has been opened a few times. Alright, so to begin, I will grab my sterile gloves. Alright, oops, come on, don't do that. Got the fan on and it's not working to my favor. Alright, so I'd begin by putting on my dominant hand, and then I will scoop and place on my non-dominant hand. Of course, these have been repackaged so many times, they're just not wanting to go on just right. Perfect. Alright. Next, I would go ahead and I would pick up from this sterile field, I would go ahead and pick up my cleanser, and I would snap this and I would clean from the inside out in a circular motion. And then I would go ahead and drop this in my biohazard bag. I would then go ahead and grab the sterile forceps and in my gauze, and I would go ahead and dry the area. Perfect. And then I would dispose of them in the bag. Next, I would go ahead and I would palpate, and I would just check and see how the wound is looking. I note that it is good granulated tissue, it is red, and there is no odor or drainage. Next, I would go ahead over here and I would pick up my transparent dressing. I'm not going to take the backing off just in case I need remediation again. So I would then place this over here and I would initial it with my initials and the date that I made the dressing, or that I redid the dressing, excuse me. So I would go ahead and sign off on that. And then my procedure is complete, so I would go ahead and remove my gloves. And I'm going to try and do this in case I need to remediate again. But I would go ahead and remove my gloves, and then I would go ahead and ask the patient if they're comfortable, and I would perform hand hygiene. I would ask the patient if they need anything. I would go ahead and place the bed in the lowest possible position, put the handrail back up if it was down, and then I would make sure the call light is within reach. I would then I would go document the procedure. Awesome. Thank you so much.